We're just going to have the panel discussion now, but that's the brochure for Clean Ed Oz. That's in your bags with all the details on. And it's nice to see that that you're going to be taking over the world as well with your website. So we've just got the members, the people that presented earlier on the panel here. And do we have any questions for our panel?
My question's for Susan. I'm Lisa Guffey from the Wesley. You talked about having volunteers go into the clinic, obviously them being on exam and their placements had finished. What are the sort of insurance and indemnities behind asking for volunteers to go on a placement? Do they still have supervisors?
Yeah, there are still supervisors, and if basically with the insurance that the university has for anything that the students do, although we'd ask for volunteers, they haven't actually graduated. They are actually still students of the university, and so there weren't problems around that.
Okay.
So no, we were okay legally. Thank you.
Hi, I'm Amanda, and I'm currently working with the QCETC as part of the Queensland Regional Training Network. That's a mouthful. I have a question around the website. Really, it's about, as part of the project, have you managed to do any costings maybe on the running of that website and the increase in scope for the website? It's sparked off a couple of ideas and interests, and I just wondered how much you'd already done around sustainability and replicability of that.
That's a really good question. We're in the preliminary stages of costing. As Amanda mentioned, that there is a very small amount of money that has been set aside, and that was set aside for a specific purpose. That was to pilot what we could actually do with that amount of money, and that is just to maintain the website. Mm-hmm. There are a lot of features that we actually built into the website which we haven't capitalised on in this sort of phase one of the project, which will obviously involve some more cost on top of that as well. I mean, we envisaged that there could be online mentoring, we could offer clinical education training through the website, for example. And we've already thought of those things and have designed the website in such a way that the facility is there to be able to open up the website for those things. But there's cost and time that's associated with that as well.
But so the future proofing is actually in the design, which is great because that gives
right.
you a lot of scope.
Yes.
So
we tried to do the future proofing up front because we realised that to be able to add to a website can actually be a lot more complex than to actually set it up from the beginning. And so that's why we undertook such extensive consultation. And then we needed to prioritise what were the immediate things we needed to do with the website and what would be the Rolls-Royce model, for example, that, in the future, if there was the facility to do so, we could add those features on.
Great. So it's funded for another year, did you say? Was it another year or two?
Our funding's finished by the end of the year. Mm-hmm.
Oh, okay.
But we do have $20,000 for some maintenance for next year.
Okay, great. I'll probably catch you at drink.
Hi, I'm Amy Fagan from UQ. Susan, my question's for you in regards to the interprofessional clinic. Did you have transdisciplinary supervision for the students, and how did you go about training them, the supervisors?
Certainly the supervisors, so that any clinician who was involved, who was basically a supervisor or a clinical educator, the clinicians came, and I don't think I did actually say, from people who were employed by either Spinal Injuries Association or Cerebral Palsy League. Some of them were employees of the university, and then we did have to contract in some other staff in order to get all of the services that we required. So we had some workshops, we had resource manuals, and certainly across those clinicians there was quite a different level of experience as a clinical educator. We'll have far more feedback about whether we've provided enough support further along the line. It has been a huge amount of change management for them coming into this, But the informal feedback's been positive. And so I'm hopeful that we have provided them with enough. Now that we've got this wonderful new website with this interprofessional, we'll be able to direct them towards that. But in fact, there was a lot of time spent getting the resources together for what we thought was best to support them. So it will be great to have this more centralised access. So we'll know more later. Thank you.
Just about the website, I may have missed it, but did you mention anything about evaluation? I know you haven't got much money left, but did you build that in about the ongoing evaluation, number of hits, who's using it, that sort of thing, in terms of developing it more down the track in the future?
Yes, the web developers have incorporated, if that's a geek term, I don't know, but Google Analytics. So whatever Google Analytics can do, this website will be able to do. And we can also target particular parts of the website for a particular survey. So we don't have to survey the website in general. We can just perhaps survey, perhaps if we have the examinable modules, we could just, look at what's happening with those. And we could actually do a survey, a particular survey, like at the end when you've finished doing your examinable module, it'd say, would you mind just taking this little survey? We all hate that, but anyway. If you've got a particular reason to give feedback, you might be interested, so yeah, you can do that. So yes, the feature is inbuilt. Yeah.
Okay, that looks like no more questions. I'd like to thank you very much for coming up, Susan, Amanda and Andrea, for coming up and sharing your projects with us. I just want to also let you know that there'll be drinks for the next couple of hours outside. Now, I've sat through 11 projects and all of them have been absolutely fabulous. So if you've sat through 11, go and find someone that has sat through the other 11 and hear about their projects, because this is just inspirational. All the work that's been done, the value to our students, the value to the workers that are helping provide the services. There's benefits all the way around, so it's really great to hear. So have a good time. The other thing is that we'll also, the Queensland Regional Training Network is also developing their website, so we'll need to talk to Amanda a bit more, and definitely have a link from our website onto ClinEd Oz as well. But that will be coming in about the end of November. Yep. And there's also going to be, all the presentations have been webcast today. So if you have colleagues, or even if you want to come back and visit the other presentations you hadn't seen, they will be available very shortly, and we'll send out an email with the link for that as well. So share that link to as many people as you feel would like to know or don't want to know about what we do, because the materials will be there. Okay, thanks very much for attending today.